we have 30, 40 years of data that is more than enough information. The data doesn't lie. So I can understand some of the fluff and people telling you what you want to hear with cannabis, but how do you, I guess, counter with that? Because there's tons of data that backs up everything that you're trying to say when it comes to psychedelics. Hey everyone, welcome to our latest TDR Psychedelic Exclusive. Last month, ESPN released a documentary called Peace of Mind that was a film featured on head trauma and features many former NHL, NFL, and professional boxers. The film itself was filmed at a retreat in Jamaica, which is owned and operated by Wake Network. And it's getting a ton of attention. And why? Well, let's welcome in two executives from the company. First, the CEO, Nick Murray from Wake Network. Good to see you, Nick.
Thank you, Shad. Great to be here.
Good to see you as well, along with former NHLer and advisor to Wake Network, Riley Cote. Riley, good to see you again. How are things?
You too. Things are great.
Hockey season, springtime. We'll get into that later. The Leafs finally win a round, which is crazy. Things are changing. The world's changing, right? But let's first begin with the ESPN documentary that was mentioned off the top, released last month. So for those who have not seen it yet, Riley, what do you think, I guess, the film produces when it comes to teaching viewers about head trauma?
Well, I think it gives people hope, right? It's a different perspective on, medicine in general, but it's a different perspective on traditional traumatic brain injury treatment. And like I say, hope is the biggest thing here, is that a lot of people are left in the dark with no tangible solutions, or the ones they've tried just haven't worked. And I think that's the biggest thing is it's a different perspective on an ancient medicine that is kind of been reinvented. It's kind of brought to the surface here in this present time and space. And, it's helpful for more than just, TBI. That was kind of like the, what they hang their hat on in the documentary, but it's way beyond that. Yeah. Right. And it's the future of mental health, future of spiritual health. And I thought the documentary itself did a good job of laying out the information and showing different storylines and really kind of just bringing in the emotional piece and having people's heartstrings pulled at. So it was a well done documentary for sure.
Have you had a lot of athletes from like various leagues across, for that matter, the world, but for through your network across North America that have reached out, and what's their feedback been like?
Yeah, it's been very positive. Several different athletes, different media outlets. I think obviously ESPN is a large sports media platform. It's not just national; it's global. So it's gotten a lot of great attention, and I think people that were on the fence around this topic, maybe pushed them over the fence, and people that were in the dark, it's just kind of planted the seed and bring some awareness around it. So been amazing feedback. I do a lot of work with the Philadelphia Flyers alumni. And had an opportunity to speak with the alumni president and several board members around this types of treatment and potentially incorporating into some of the stuff we're doing with the Alumni Association. So, great feedback all around.
Yeah, that's great. Well, as Riley said, Nick, ESPN comes in and films at your retreat in Jamaica. This is big exposure, obviously, for a network like that to shed light on the industry as a whole, and more specifically your retreat as well. What's been the feedback, I think, from a business model that you've seen since the documentary has been released?
The feedback has been tremendous. We've had outreach from a number of different sports organizations similar to ESPN that are interested in telling a story similarly with players from their countries and their continents. We've also had just kind of anybody come along and want to participate. We've really tried to bridge technology with the ancient wisdom and these ancient medicines, and we're really excited to kind of use technology to show some of the things that are difficult to show just with anecdotal comments and evidence. So it's really resonated with quite a few people, and we're really excited to bring it to more and more people.
Nick, why do you think ESPN reached out to you specifically, the company? Why did they want to film there?
Industry up and down, and our whole mission has really been to bring this to more and more people. We didn't go public early. We were really, it was important to us to really make sure that we had an important thing to say when we do, and we wanted to build a foundation that was very strong. And I think the technology being used really resonated with people. I think they really realized that, these guys and gals that are running Wake are doing it on a different angle, and I think that really resonated, that we are using technology, whether it's our patient-reported outcome forms, our technology such as the EEG, or our heart rate monitors. I mean, we're really trying to bring data to this and allow for research to be done at our retreats, more than just a retreat. So I think we stood out on that angle, and I think that resonated.
Do you think that is Jamaica like the go-to destination, you think, as the industry starts to develop and mature, as being, I guess, a go-to destination for just the expansion and growth of the industry that many people like? What's the demand like for people wanting to attend something like this?
Yeah, the demand has been very strong. Jamaica has really opened their arms to us. So it's kind of one of the most popular federally legal jurisdictions that allow for psilocybin to be ingested, grown.
Yep.
We really do a farm-to-table approach in Jamaica. So I think that'll continue to grow. The government's been very hands-off. They've allowed for the actual industry to kind of self-govern and to really work with the government without a very heavy hand. And so we're committed to continue to do our research and development there. It's really our R&D headquarters, and we'll continue to do that as long as we can. We will be bringing all of the knowledge and all of the research we've done in Jamaica onshore. So we'll be starting in Oregon, of course, and then moving into Colorado with a multi-state operator model. And but Jamaica will continue to be our R&D hub.
So you're going to expand into the States then?
Absolutely. Yeah. Everything we've learned as far as the farm-to-table approach of psilocybin in Jamaica, we will be bringing that knowledge on into the U.S. and working state by state to really bring all of that knowledge in and allow for people to have increased access and not be required to get on a plane to actually benefit.
Riley, anytime that you're a sports athlete, especially in the NHL, it's going to obviously grab a lot more attention quicker than the average, person suffering from something like this. Are working with the Philadelphia Flyers alumni. I have to ask, with your career with the NHL, how's the league been responsive towards this sort of initiative that you're trying to shed light onto? Are they big supporters of what you're trying to do?
Well, I think they are supporters. I think there's just a lot of, politics to kind of position their takes on it. I dealt with this with cannabis, with the NHL Alumni Association early, where, some of them are believers in it, but as a whole, there's just a lot of, question marks and fluff around it. So you see the same thing with this. I know internally as individuals, there's a lot of support. But as far as coming out with a stance, I think it always goes back to there's not enough science to support it, type of comments. But slowly but surely, I think this is kind of what we're doing at Wake, and part of the ESPN piece is kind of is to say, okay, we're going to show you then. We're going to show you and make you guys believers, because not that they're not, like, as I mentioned, but just kind of pushing them over the edge. But, quietly, individuals, a lot of support. I think people are, very, becoming more in tune with what's out there. I think cannabis kind of paved the way for, alternative thinking. Or the original thinking, if you will. I think, you also do have a lot of old school minds that you have to help transition. But overall, the support I've gotten as individuals, even again from the Flyers alumni and some of these, older generational players, has been extremely supportive.
So you plan to expand in the States. Like when you say stuff about there's not enough data, I can agree with that from a cannabis perspective. But from a psychedelic perspective, we have 30, 40 years of data that is more than enough information. The data doesn't lie. So I can understand some of the fluff and people telling you what you want to hear with cannabis. But how do you, counter with that? Because there's tons of data that backs up everything that you're trying to say when it comes to psychedelics.
Well, yeah, and I fully agree with you. There is a ton of data and research, right? It just that is always what people hang their hat on when there's ignorance around something, right? They either haven't done the work to explore any further, and they just hang their hat on that statement. It's an easy position to have. and I'm honestly tired of it. It's just like, okay, we have to evolve past this way of positioning and thinking, and really look at what is the future of mental health. There's no question. It's undeniable. The data is very, very clear. The anecdotal is very clear. The experience is very clear. So, it's just getting over ourselves and our ignorance and really kind of following the legitimate data that exists and building upon that.
Yeah. Well, one thing I learned last week, and it kind of blew my mind away, there's 14 million Americans annually that are suffering from PTSD. 14 million. Like, that's a staggering number. And one thing that really grabbed my attention last week too was clinical trials related to depression. There was 0% human trials dedicated for depression in psychedelics 3 years ago. That number today is now 25%. So we're starting to see growth overall in the industry. So, Nick, as we talk about awareness towards head trauma, the retreat itself, ESPN filming, how do you see, I guess, the long-term trajectory when it comes to scaling up the actual business model of it all?
Sure. Yeah, it's a hybrid approach. We'll continue to do our own retreats, our own clinical immersions, and then we'll also partner on site in the U.S. with partners. We announced a couple of partners last year. We'll be announcing a few more this year. We're really excited to leverage these partners for a decentralized kind of research approach. We see a big approach where you can leverage therapy as well as research at the same center. And as you mentioned, there's a growing number of people both in the PTSD world, the depression world, that really need a novel therapy. They need something new. We've been doing the same thing, whether it's SSRIs or SNRIs for decades, and it's just not working. We're seeing from the clinical data that a lot of the time placebo is basically the equal of SSRIs. I mean, that's just terrible for people that are on these things for decades.
Isn't it?
So it's nuts. I mean, when you think of the cost, both private and public, as well as socially, that this has really brought to our society, we do need something new. And so if we can leverage a hybrid approach and really work with existing clinics as well as new builds of our own, that really speaks to the name Wake Network. We built this to be kind of a connector. We're trying to go for something that's very decentralized, that we can learn from our work in Jamaica, both in the growing side, the actual administration side, and then we can bring it to people and work in a collaborative fashion, because it is one of those rising tides lifts all boats. I mean, we really are in the earliest innings ever. So if we can bring that knowledge, allow for a platform approach to really allow for people to benefit from that knowledge and then use that to help others, I mean, that's really the goal of the company.
Have either one of you had internal discussions, and what do you think that catalyst moment will be for the industry that, I guess, makes a turn for the better, where it's like, look, this industry has grown exponentially over the last year, 2 years, like huge. Like, I remember being at the conference in Miami with you, Riley, a year and a half ago, and where we were then to where we are today as far as research, it's like that seems like 10 years ago now. But you look at readouts that MAPS is going to have pertaining to MDMA. If that's as strong as they say, is that, I guess, a catalyst moment where we could see a lot of attention, awareness, and a turn for the better for the industry? A question for both of you.
Well, I mean, I'll jump in. I mean, yeah, you mentioned the MDMA and the codes maybe before we got on this call, even that were recently announced that I think at the start of 2024. I think it's just about bringing like legitimate access through traditional healthcare providers that I think will be the catalyst to maybe allow for more psilocybin research, or maybe pave the way for psilocybin. I think it's phase 2 anyways, probably not too far behind MDMA. And then, the ketamine play that already kind of currently exists. But I think once you start bringing in codes and insurance can start covering these, it's more accessible. I think that is probably, the thing that moves this thing along legitimately. So
that's interesting that you brought this up, because CMS made an entrance code where Medicare is going to cover psychedelics. This was for psychedelic therapy beginning next year in 2024. Nick, can you talk about that announcement that was made recently and how that plans to unfold?
Yeah, it's really exciting. I mean, we see that, and then we also see the at-home ketamine being allowed as well in all 50 states. So
you do see that? Wow.
Yeah, there's quite an interest, and a lot of people don't know this, but Medicare very much leads the other insurers, and so if Medicare covers it, then the other insurers kind of have to follow along, and so it's really been a push to get them to come along, and obviously there's a lot of unfunded liabilities in the U.S. and insurance, and Medicare is at the forefront of that. And so I think hopefully they've really done their due diligence. They've seen that, you know what, this is going to help a lot of people, number one. It's actually going to be a lot more of a cost savings measure for us long run, because if you think of the amount of money that's spent on things like therapy and SSRIs, antidepressants over many years, because, you know, you don't really hear about somebody getting on antidepressants and then 6 months later, you know, they're happy and they're good to go. It usually is, unfortunately, a perpetual, year after year.
Usually add in another SSRI, and the next thing you know, a year, 2 years later, they're taking as many as 3 or 4 just to balance things out. But to your point, you never see a happy ending, do you?
Unfortunately not. And I mean, the costs just go up and up because people need more therapy, they need more drugs. And so as a society, I mean, number one, we should be caring for these people just to get them better, regardless of the cost. But if we're not seeing results that are remarkable, and we're not, unfortunately, and Prozac was an 80s kind of invention, so we're far along to really look at the data, then we should be doing something else. And if that's something else, like we see at our clinical retreats, is working, then, you know, it behooves us to actually do it. Yeah. So the CMS code's coming out. I mean, hats off to MAPS for really pioneering a lot of the work, a lot of the clinical trial work on MDMA that I think has really informed the regulators and has really given them the confidence to do a lot of these changes and authorize these CMS changes. So I think what we'll see is a collaborative between ketamine, MDMA, and hopefully psilocybin on the state level at least, that will push all of this forward. And once the anecdotal evidence comes out, people start talking. It's very similar to cannabis. So similar to cannabis, how we had Charlotte and Charlotte's Web, I think you're going to have hundreds, thousands of Charlottes. Whether they come from PTSD or depression, I think that's really what's going to happen. And, you know, obviously psilocybin is our main focus, but, you know, there is something to be said about ketamine. There is something to be said about MDMA. And then there's a number of others like iboga, ibogaine. So we will see a bit of a tidal wave coming as these are authorized and as more and more people and more families are positively affected. So really excited about this positive change.
Interesting. Nick talks about the at-home care. Since I spoke to you last, Wake Network, as Nick talked about some of the partnerships that you guys have done over the last year or two. One of them is Revitalist Clinic, which is a publicly traded company that focuses on the psychedelic clinical model across the U.S. Maybe talk a little bit about, I guess, the strategy and the partnership that you have with them, and most importantly, how you see it expanding over the next year or two.
Well, I'll let Nick talk to that one because he's obviously on the ground with that relationship. So I'll pass that ball on.
Sure, happy to. It's been a great partnership so far. We've been able to train a lot of their staff on psychedelic and psilocybin therapy. So now she has staff. We're talking about Catherine Walker over there. Yep. They have staff that's trained on both ketamine and psilocybin therapy, which is wonderful. I mean, that's the future. I think the future is personalized multi-psychedelic therapy, where people come in and it's not a one-size-fits-all model, and they start on one compound and hopefully they're good after that. But if not, then they can graduate or add another compound before they get to some of the hard stuff that we see kind of in the current model. You know, they are offered a psychedelic approach. And so it started with training. It's expanded so that our guests can have their therapists actually see them and a lot of the time actually bill that to their insurance companies once they're back on shore in the U.S. We will be doing joint venture clinics together so that we can actually learn and start to pioneer this model where you do have multi-psychedelics under one roof, legally available, starting in Oregon. But we're really excited about some of the other states that look like they're just on the cusp of coming out similarly to Oregon. And so it's a training, a therapy model, and a research model.
Well, the training part, it's going to have to, if we see progress made and the FDA does approve certain compounds, as we said, like look at Australia, psilocybin and MDMA, that's going to happen in Canada and the U.S. relatively soon. And I'm hearing stories that anywhere between 50 and 100,000 therapists are going to be trained overnight, which is Is that enough, do you think, when I bring up a stat where 14 million people are suffering from PTSD? Do you guys both think?
I mean, probably not. No, I mean, and that's way beyond PTSD, right? So, and I think a lot of the clinic models is as pertains to the MAPS model is 2 therapists per 1 individual. So it's like I think the number needs to be significantly higher, honestly, if it's going to scale as quickly as we're talking about here. So.
What's the number do you think makes sense then, Riley?
Oh, geez, I wouldn't even know where to begin. I mean.
Yeah.
And yeah, I mean, I'm not even going to try and throw out a number because I think it needs to be a lot. And I don't think that it needs to be, like they need to be, medical doctors or psychotherapists. I think it's going to, encompass a lot of different types of facilitators, social workers and whatnot. Right. I mean, it's holding space. But I think the number is going to have to be a substantial number because there's liability obviously with some of the stuff that's happened in the past, and especially if you're going when you're talking about one patient at a time. I think
Right.
Starting with Oregon, I think you might see more group settings. I think there's a little more sustainability there. Doing having say less therapists, more patients at once. But nonetheless, doesn't change the amount of therapists, facilitators. That we're going to need to help support this industry.
Yeah, agreed. Last thing I'll bring up, Nick, almost 2 years ago, Wake Network received conditional ethics board approval for the Ministry of Health and Wellness Jamaica to conduct a phase 2B psilocybin microdosing clinical trial together with the University of the West Indies. So looking back, the receipt of this ethics board approved marked the final steps towards receiving conditional approval to begin the study. Did that study get off the ground? Whereabouts is that right now?
Yeah, we decided to do that study onshore. We decided to actually do it in the U.S. We saw that there was coming, and it's actually been approved now or announced that there will be authorization from the FDA to do decentralized clinical trials, which is wonderful. We had kind of early knowledge of that, and we thought, if we have the opportunity to do it in the U.S. for a similar price, is it worth waiting? And,
Right.
we made that decision at the time. And so, we were hoping that announcement would come because, how the rumor mill can be, and it did come about, a week ago. And so I can share that link to the show notes. But that's a very positive, outcome from the FDA that we will be able to do decentralized clinical trials, meaning we're really going to be allowed to use real world data rather than just the kind of urban environment, go to a clinical research organization, which we really wanted to be able to do. We wanted to be able to have a wide swath of people, a very diverse subset of people, not just from the urban environment, which is where usually clinical trials are done. And this will allow us to do that. So we'll be able to recruit from all 50 states. We'll be able to incorporate clinics and then also gather data when they're at home. So the actual dosing will be done in a clinic, of course, but gathering data like sleep and activity, that'll all be done remotely. And that's really what I think will bolster a study, not only just the N or the number of people in the study, but how much data are you gathering from those Ns? And we aim to gather a multitude of data, both on sleep, activity, and then also how they're feeling. So, we had to delay it, but I think it'll be a stronger study.
Company's still private. Is there still goals to take the company public?
Yeah, we have been around a while. We started in 2019. We rode that wave. There was a lot of interest to go public. I've
Probably good you did.
done that.
Right?
In hindsight, it was. My last company went public. I took it public, and I know the game. And I just thought, it's better if we hold out. And
Walk before you run.
That's it. Build the foundation, get to profitability, and then you're able to really conquer. So certainly in the path, but we weren't in a rush, and I'm glad we weren't. As you say, there's unfortunately a lot of our peers that have not been able to make it. And we'll continue to just keep delivering and keep making announcements, and then when we're ready and the market's ready, then we're definitely willing and open to do it.
Yeah, well, I think it's going to happen sooner, a lot sooner than what we're. I know it's been a long, dog days of the industry as far as the capital markets side the past year and a half, but I do think that we're on to something here, and there's some momentum building behind the scenes. But want to thank both of you just for checking in. Appreciate the time. Before I go, I don't know how much you still like to talk about NHL games, Riley, but who's your pick to win the cup? Come on, you got to give me something.
Well, I had Boston Bruins, and that was a huge upset.
Why is that?
And I would love to say, like Toronto Maple Leafs. I'm liking Florida right now. I'm liking their vibe.
Yeah, I have to admit, after watching Game 1 earlier this week, I can see why Florida beat Boston. They're a good team, but people forget they were first place in the Eastern Conference last year, so
exactly.
Maybe they woke up. But one thing I do miss is going down to Sunrise. I remember last year buying 2 tickets, 8 rows up at Center Ice. I think I paid about $225, and then a week later I went up to a Leafs Lightning game, and I think I spent about $1,400 for 2 tickets.
Right.
Anyway, we'll see how that all unfolds once the series shifts down there. But again, I want to congrats you guys just basically on the ESPN documentary, and let's keep in touch.
Absolutely. Thanks, Shad.
Absolutely. Thanks a lot,
guys.
Bye.
Hey everyone, thanks for watching. And if you want to learn more about the emerging industries that we cover, then leave a comment below and let us know who you want us to interview, the questions you want asked, and the information that you want to learn. We want to hear from you. As usual, click on that bell for all notifications to get the latest information. Share this video with your network, and don't forget to subscribe to our channel because we would not be here without you. Thanks for watching, everyone.